Hi everybody, and welcome to Series 2, Episode 3 of In Conversation with the CEO. Today I'm joined by Stacey Woodall. So Stacey accessed services some time ago with the organisation, and Stacey's deaf and has come to talk to us today about some of the challenges that she experienced accessing our services and the work that she's done working with LSCft to help improve services for people like her that are also deaf. So welcome, Stacey.
Thank you.
Do you want to spend a bit of time just introducing yourself?
Well, as you said, my name's Stacey Woodall, and I became involved with LSCft a while ago after having a really bad experience. I really struggled accessing services, interpreter problems, and I kept telling everybody that I was deaf. Nobody was putting it on my file on the computer. There was a complete lack of awareness. So when I arrived and they went, "Oh, you're deaf." And so my appointments were cancelled time and time again. And I'd get a letter and then it'd say, "Please ring to make your appointment." It's, well, how am I going to do that? How am I going to ring? So that in itself was a barrier. And not having it on the computer that I am deaf made even making initial contact. And then when I got an interpreter, finally, I didn't like them. They just didn't match my style. And I went through a variety of interpreters until I found, the right person for me to enable community psychology services to help me. I had 12 sessions and it was really good. But some of my friends have expressed that they've had the same problems with lack of access to interpreters. So it is a massive challenge.
And is that something that is across the NHS?
Oh no, it's all over the NHS. I mean, I do think because mental health is so important, communication, deaf people really suffer. So there's no communication, there's no support out there. They can't access services. There's a service called Shout. They don't understand what that says, what that means. So we need to improve those services. But I mean, no, you're not unique. Hospitals, we're all used to in problems booking interpreters and having interpreters accessing appointments because they're just not informed. So it's not just you.
And that bit about having an interpreter that you can relate to and have a relationship with, how important is that?
Yeah, I feel it's really important to have that rapport with the interpreter because they know what I'm saying, they understand me clearly. Without any interpreter, it's down to writing down, which has an effect on my mental health. And it's just easier to be fluent and have a fluent conversation in my own language and express myself in my own words. It's just so much easier and clearer and less stressful.
So back in 2021, Stacey, you came to our trust board to talk about your experience, and since then you've been working with the trust, with our patient engagement team specifically. What progress, what changes have you helped put in place at the trust?
When I initially joined, it was like I was a rabbit in the headlights. It was daunting. It was like there were so many access issues. So and we're still not there yet. We've got a long way to go. But it's been really interesting learning about the different ways things work. So I'm just really hopeful that we're going to use more relay video interpreting services and we can improve that. I mean, I know you've got text and Shout, but I want in BSL, I want it accessible. I want a deaf person to be able to see and know, and they can just book an interpreter, they can book their appointment online without having a letter say, please phone. It's tiring. It's just tiring.
So we use quite a lot of videos internally to colleagues across the trust. And I'm just thinking, previously, I don't think we've had somebody sign within those videos. And that would seem an immediate place that we can start and make improvements.
Oh, absolutely. Yeah. I mean, America is just a way ahead of us. They sign everything. And unfortunately, we're a long way behind American Sign Language users.
So just talk me through, you mentioned there around some of the video. And so if somebody was accessing services initially, so we've got an initial response service, so where you would go for any support with your mental health. If you were deaf, how would you want to access that service? So at the moment it's a telephone number, but in an ideal world, how would that service be accessible?
I mean, there are two companies, Sign Live and Sign Video, that provide remote interpreting services. But you've got regional signs, so you've got interpreters from all over the country. I can click on that number and say, please, can you ring them? But we're in the queue. And so you're in the queue for a long time. So I would just like to, so for example, if I'm in crisis and need help, click on somebody and get an interpreter who would then go directly through to a support worker, rather than end up in a queue for half an hour where, still in the queue, still on hold. When you're in crisis, you can never predict when it's going to be, and it could be a lifesaver.
Okay, that seems like something that we can really prioritise in making access, and it's not just access to our mental health services, but some of our physical health services, and how we can really support with some of this, I suppose, technology that's out there now.
Absolutely. Yeah. I mean, VRS has improved the conversations. I mean, I know it's baby steps, but I mean, it's improved my conversation with Leslie.
And so I suppose if we've got colleagues that are listening and watching this podcast now, what would some of the take-home messages you'd want them to think about their service and their interactions with people from the deaf community?
I think for some deaf awareness, if a deaf person on reception to have some basic communication, just to make somebody feel at ease. So very, very basic signs like hello, welcome, just a little bit would put somebody at ease, because they're already anxious, and it's like, they've got deaf awareness. And it's like, oh, don't worry, the interpreter's going to arrive. So having that pre-booked makes the individual feel comfortable and relaxed and de-stressed. I'd like some staff, if they haven't got an interpreter, maybe for some of the staff to go through level 1 and level 2 training, which would help. It's not ideal, but it would help. I've worked in a mental health unit in the past, and I know how difficult it is to communicate. So I think mental health units need to look at thinking about how they communicate with deaf patients in there. So that's another area that I'd look to in the future. But I mean, it's not just deafness. There's a variety of disabilities that need to improve access.
Yeah, and one of the first things that I think when we met just before was the fact that I don't know any sign language, and I felt really uncomfortable. So that is definitely a learning for me going forward, that I need to to push myself into learning. Just that bit about saying hello, how are you, would have been a nice way to greet you. So I apologise for that.
It does. It makes you feel less awkward, and sitting there going, I don't know what's going on. It just puts you at ease slightly.
And we've got Deaf Awareness Week coming up on the 6th, starts on the 6th of May. So is the...
That's right, yeah.
Yep. What are the messages? Because I think we need to... It's not... We've talked about the NHS, and we talked specifically about LSCft, but this is a wider community awareness, isn't it? Absolutely.
I think deaf awareness is vitally important because people don't understand the access problems. Lockdown was horrific. Deaf people had very little access to anything and had a massive impact to GPs. It was utter chaos. People with mental health issues. It was COVID really was impacted people. So we are campaigning against the law. We want interpreters as they have in other countries. They're now teaching it as a GCSE, which is a new law that's come into the statutes recently. So we're going to be that's going to make things far more accessible if we have a new generation of deaf people being able to sign. You've got big D and little d. So deaf people, big D, are sign language users, whereas little d deaf people are cochlear implant users, speech users. There's a whole variety of deafness within deaf awareness. So deaf awareness training would be useful.
That's really good. And that's a bit. Where can people go if they wanted to learn more about sign language and British Sign Language and how they can learn?
At college, there's training at colleges. There's level 1, level 2, and if they want to go more advanced, then it would be onto university to get level 6, like Carol. And if you just you could look online for interpreters or contact Carol, and I'm sure she'd be able to help you.
And we saw, didn't we, with Strictly Come Dancing, and I suppose that brought some of the challenges to deaf people into everybody's living room. Do you think we need more representation, full stop, across media?
Absolutely. Yes, absolutely. There's nothing a deaf person that can't do. There's nothing. It's just a different language. They can work as a doctor. They can do anything. They're just working in a different language. So absolutely, yeah.
That's really, really good. And you were talking then before we started the podcast about your wanting to go to university and then come hopefully back into the NHS. So that all sounds really, really good.
Yeah, that's my aim. I want to change things for the future. For all disabled people, I want to make it more accessible.
Well, by working with us, you're definitely making that a reality for people that are accessing our services, whether they are mental health conditions people are contacting us with, their physical health, or any of our learning disability or autism services. I think what we need to do is really embrace what you're working with us and spread this across the organisation. We're a massive organisation, but working with you, we can definitely make this better for people accessing services.
Oh, I'm in no doubt. It will be a huge challenge, but one that I'm looking forward to. I fought the government and we've won. So, yeah, I'm determined that this is a challenge we will win.
Well, thanks, Stacey. Just a massive thank you for joining us today, and 2, for just everything you're doing with LSCft since you first came on to tell your story at Trust Board, and I hope you continue to work with us for many years to come. So thank you very much.
Oh, absolutely. I love it. Absolutely. So yeah, I'm up for anything.
Brilliant. That's fantastic. Great. Well, I hope you've enjoyed that podcast today, finding out some of the challenges that some of our communities, our deaf communities, face when accessing healthcare, and how we here at LSCft, working with Stacey, are trying to make it a bit better and more accessible for people. But clearly, we've still got a long way to go. So hopefully it'll be great to do a podcast in a couple of years when we reflect back and see hopefully a real improvement on this journey in accessibility for deaf people. Thank you.